अगर हम लोग के पास एक पेशेंट आता है, like there will be resistance to change, right? So we have to bring a person from pre-contemplation to contemplation. But what are the important aspects? If a person needs to quit, what is that? Patient has already come into that withdrawal symptom stage, right? When the person, we are asking that person to quit, what will have? He will have withdrawal symptoms. And then what will he do?
We'll manage the withdrawal symptoms.
We will manage the withdrawal symptoms. But what he will do?
He will start
take
doing
more.
again.
He will start again. Urvashi says he will start again. Exactly. He will again have a relapse, right? Or he's likely to have relapse. So we have to be able to control his withdrawal symptoms. So what we need from him? A commitment.
So trust, assurance that we feel that
we will give him the assurance, and we need a commitment.
Commitment from him.
Right? We need a commitment from him कि yes, अगर मेरा withdrawal symptoms होता है तो भी मैं आकर के मल्लिकार्जुन से मैं बात करूंगा, बट मैं तंबाकू नहीं लूंगा. ठीक है? And we will manipulate or we will adjust the doses of medication that he requires. Right? Or we will adjust what are the different types of withdrawal symptoms he is having and how to address those issues. We'll address those issues. So that उसको जो परेशानी है उसको हम लोग, if we can take care of that, we are through. We will give him 100% results. Am I right?
yes, sir.
This cannot be a one-time prescription. We do not give just a one-time prescription, but it has to be a regular intervention and regular change of the plan that we need to give. Okay? That is why we need a regular follow-up and a close follow-up for these patients. Okay? So commitment is on both the sides. Commitment on the side of
Doctor and patient.
Doctor also and patient.
Right? ठीक है ना Nikita? Doctor and patient. So I'll just quickly go through. I've given you the gist of this thing. So this is just me. And what is this WMACD? The mantra for successful tobacco cessation. Yeah? This is WMACD, right? So what is that? W is willpower, M is for motivation, A is for assurance, C is for commitment, D is for declaration, right? So make the difficult transition pre-contemplation to contemplation easy. Your handy. So we will just learn about this thing. WMACD, that is willpower, motivation, assurance, commitment, and declaration. ठीक है? So what is this willpower? हम लोग जनरली बोलते हैं ना willpower होगा तो सब ठीक हो जाएगा. ऐसे ही बोलते हैं ना?
Yes, sir.
तो क्या है वो? What is that willpower?
Courage to quit the habit.
When do we need the willpower? When do we need a willpower?
So when something is difficult.
Yeah, when you
want intense desire to feel that object, target, then you will develop the willpower. When you feel that it is the right thing to do, then you put up your all things, and that with the courage you can do it.
So exactly. So when you think it is a right thing to do, you don't need a willpower. You will do it. You're motivated to do it, right? Willpower is only used when you want to do something against your will, right? मेरे को ये चीज करना नहीं है, मेरे को ये चीज करना है, मेरे को ये रसगुल्ला खाना नहीं है, लेकिन तो मेरे को विल पावर चाहिए टू कंट्रोल दैट कि आई डोंट टेक अप दैट रसगुल्ला. ठीक है ना? But if I believe that rasgulla is going to cause harm to me, I have got diabetes, I have got very high diabetes, I have got this thing, and if I take that rasgulla, my diabetes will increase, I will go into ketoacidosis, I will have this problem. So what I will do? Will I take that rasgulla? I don't need a willpower to take that rasgulla.
No, but sir, if the desire is there, then again it will take, no?
Yeah, so desire is there. That rasgulla, my old thought is that, oh, that's sweet, it's so nice, it's so wonderful, it gives me a lot of pleasure. That is there in my brain, right? But the thought process is also that over that thought, there is another layer which says that if I take this rasgulla, I am going to get a disease. My blood pressure, my blood sugar is going to increase, right? So what will happen? This second part will take over and I will not take that Rasgulla. Right? So if there is a desire, I need a willpower. But if I understand, I don't need a willpower. So most of the time, these people who are taking smoking with willpower, because they are habituated, they are loving the smoke, they wish to smoke more and more. They are not ready to come to you. They will be brought to you. And that is the time when the person is forced to be brought to you, and that is they come with the willpower कि ना मेरे को इसको stop करना है, ठीक है ना? But they may not be ready to quit.
Yes, sir.
They may
have
not
an amygdala hijack. So you have to be able to see they have an amygdala hijack that time.
Right. They're not ready to quit, but they have been brought to your clinic with their forcing their willpower, overcoming their will to take tobacco, and they have come to your place. Right? Now, once the person comes to your place, now what to do? So let us just see what is the willpower, then we will see what is the next step. Right? So willpower is the ability to stay determined on quitting. Build your mental strength with self-control exercises. Willpower can fatigue. Keep it refilled. Do not oversaturate. It can go up and down. Willpower is never stable. Practice exercises repeatedly to deal with tempting situations and to start developing willpower. Right? So that is measure the willpower index regularly. So there is a measurement here. If you will see, assess the willpower index in the app. That is this willpower index there. Right? So you can assess the willpower index. There are some 20 questions that needs to be assessed the person, and it is very interesting. You can do it yourself also. You can check your willpower also, and this is very interesting. Tobacco users and smokers believe they are strongly willed, and this is the biggest myth. अरे जब इच्छा होगा मैं छोड़ दूंगा, मेरे को पता है कब छोड़ना है. I know when to quit. Right? So I will be 40, then I will quit. You know? 10 years tobacco doesn't cause any harm, so I know I will take for 10 years, and then so that is the biggest myth. They are in the biggest imaginary world, right? So how to maintain willpower? Bring the patient to your clinic. This is what I said. It will bring to your clinic. Willpower is like doing something against will. Prepare a patient mentally to adopt to the non-smoking routine. Discuss, address the challenges. Help them adopt to new form of happiness and pleasure without the nicotine kick. Please understand these sentences. See, now this person has come to your, and he is enjoying his cigarette because he has got, with willpower, he has come to your clinic. Now what? Now we have to bring a change in his thought process so that he doesn't have to do against his will, but he starts doing for his happiness, for his body, for his health, for his financial health, for his physical health, for his social health. Right? So he will start working. So our job is to bring him into, assure him whatever problems he has been having, give him the assurance, discuss with him, and reward him that yes, there are many things that he can do which will give him the pleasure as good as taking cigarette, and he will not have the withdrawal challenges that can be taken care. Right? That is so now once he is there, now that is what we call it as motivation. And this is, if you have motivated him enough, if you have given him, so how do we motivate that person? He has come with the willpower. Now we have to motivate him to quit. Right? मैंने जैसे बोला, yes, you can get the pleasure. Our motivation is the most important aspect by which this person will continue to come to you or he will stop coming to you. Right? You have to make him sure that yes, he is at the right place. Right? A factor that pushes a quitter to get started and gives them a direction to begin the change process. That means from pre-contemplation, he is now ready to go into the contemplation. So that is the motivation. Change the thinking process, right? That is what the motive. Continued motivation is essential. Help your patients identify their own motivating factors to stay quit. Right? This is very important in the sense, why does he want to quit tobacco? What is the reason he wants to quit tobacco? So that if we can address those issues, then probably it will be, we can recognize and we can actually go ahead with that particular thing. Suppose I want to say in very simple way, if a young lady has come, she is just 22-year-old or just recently married, and she is worried and she is a smoker. Now, if she is recently married, what does the lady want?
Child.
A child, right? And now, if that lady comes and I start talking to her that, look, tobacco is going to cause you cancer, it will cause you a heart attack, it will cause you this thing. Will it affect her? Will she think on that?
No.
No. So what do we have to speak to her?
Regarding the child. That you
Regarding
have
infertility, the tobacco and infertility, tobacco and low weight birth, tobacco and
sudden infant
her
death.
health at this age, right? So we have to do relevant thinking, relevant discussion with that lady, right? So if we can give her the real factors, the motivating factors for her would be her infertility and her child, right? So if we can motivate her, if we motivate at the right direction, so help your patients identify their own motivating factors to stay quit. So if we can talk to her what is her importance and how it is going to affect her, so this is what she is going to take care. So motivate the subconscious mind to make the quitter consciously strong to stay quit. ठीक है ना, उसके दिमाग में इतना सब भर दो कि वो consciously she will become strong, that he or she will become strong, that they will remain quit. ठीक है? Keep fueling and maintaining the motivation, visual reminders, buddy support, addressing mental roadblocks, seek support. Yeah. So visual reminders, as you see on the cigarette packets, you can see something. You can show infertile lady. You can show some visual reminders can be there. A lot of visual reminders can be there, right? Buddy support. That means a person who is quit, he can become a buddy, right? So there would be an example that yes, it is possible to quit. Addressing mental blocks. भाई मेरे को ऐसे करूंगा तो मेरे को ऐसा हो जाएगा. If I quit smoking, I will not be able to go to my, I will not have potty. I will not be able to urinate, right? तो उसके जो road blocks है उसको हटाना है. ठीक है?
Yes.
Every person will have their own roadblocks, right? And seek support. That means seek proper support. That is the doctor support, the specialist support. Define milestones and help your patients achieve them. Dhire dhire, either gradually or cold turkey or whatever way will help them to define it. So different ways of motivation is assured expert intervention. Assurance it is possible to quit. That is, I am a specialist. Look, I am trained in that. I have got 200 patients who have quit. I have the knowledge, right? Quantitative assessment. Yes, the quantitative assessment is another thing that we need to do. And that is, we need to give them the regular, क्या बोलते हैं उसको, regular quantitative analysis, regular नहीं, but basically what is the right present situation for him? What is his carbon monoxide level? What is his health problem that he has started having, his hypertension, leukoplakia, submucosal fibrosis, or some other problems that he's having. So we can do a quantitative assessment of this person, right? Even his lipid profiles, we can do some biochemical profiles. So that can be there. Then comes the buddy discussion. That is, we can ask some of the buddies to talk to them. Family support is another very important, and group counseling. So these are the various motivation. And now we have got quit coaches who actually talk to the patient on a regular basis, giving them the assurance and motivating them through their journey, right? So through that journey, we have to keep them motivated. Now that they are motivated to quit, now what is the assurance that they will have to be given? What is the assurance they need? Assurance will determine if the patient will continue to quit, right? And what are the assurances? I am there. The most important assurance is that I am the specialist, I am trained, and I am there to handhold you. I am going to help you out during your journey. Build trust and confidence. Actively listen to that person, right? See, this we will be talking more in details, but actively listening is more important. He has his own story. He will keep on talking. We need to listen to his story, by rather than just interjecting. नहीं, मैं जानता हूँ, तुम कुछ नहीं जानता, बताओ. Address the withdrawals and other challenges. Right? We have to address the withdrawals and other challenges that this patient is having. And Design a comprehensive quit plan. This is very important. We have to design a comprehensive quit plan for the provide informational guides and resources as required, educate and empower every patient. Right? We have to educate and empower about the various aspects, the diseases, the health belief model, the financial belief model. We have to educate that person, help patients to think better, feel better, and visualize better. Think better. That means he has to think about his health, feel better that he has started feeling better, and he will be much better once he quits tobacco, and visualize his future that yes, in the future, he is going to be really doing something great. Right? Okay?
Yes.
Yes, sir.
So change thinking leads to announcement. So now that he has motivated, he's ready to change. Now what will happen? We need an announcement, right? So he needs assured. Now he will do an announcement, right? Thought is an inner subtle action we take inside our mind, and when it is there in the mind, he is ready to say that yes, I am ready to quit. I am committed, right? The inner action manifests itself into words and physical actions. So the best way to change our words and action is to change our thinking. अगर हमारा thinking बदलेगा, तो हम लोग आगे का, right? So determination, the cornerstone of commitment. That is, once we are determined, we are committed. We will go ahead, commit to quit, determination to quit. Discuss during the journey. The quit coach and specialist will help. Stay quit, right? In the minds of the uncertainty, keep determination in your thoughts, and that will become like a guiding light in front of you. The impossible becomes possible for those who have the power of determination, right? So here comes the commitment. Now this person is gone through that. He's now committed. Now he's all the assurance, the willpower is there, the motivation is there, assurance has been given that I am there with you. Now he has to commit, right? Building ready to go, the person is in. That means the commitment on both the sides, he is ready to go. I am committed and I am with you, doctor. I am going to take care. I will be there, right? So this actually gives them the, ठीक है, क्या बोल रहे हो? Anything? So the commitment is build a powerful commitment to quitting in your patients. Strong commitment without negativity brings grave success. Commitment helps him to maintain a steady stream of thoughts without changing or achieving, without changing the direction, and helps achieve quitting. Create a desire in the patients to quit and build a powerful thought to quit, and hence reverence to build determination and commitment for quitting. Right? So promise, conclusions, competence, behavior, trust, success, all this part is of commitment. So once he's committed, the very next step that you know that this person is going likely to succeed or not to succeed is when he declares. Declare, that means he says, he gives in writing, I am ready to announce, I am ready to tell it to everyone, I am ready to quit. Okay? And he declares the quit date. He declares he announces in to his friends, to his wife, to his children, to the vendor, to his employer, and to you and to himself that he is ready to quit, and encourage patients to declare to the vendors, family, colleagues, and friends that you are ready to quit. Seek help and support. Make own environment, workplace, home, and car clean. That is, clear your environment. Make the environment clean. No more tobacco anywhere. Declare your quit date. Ask peers not to offer your tobacco in any form. भैया और मेरे को तंबाकू नहीं देना. I will not take tobacco in any form. So announcement of commitment makes a person stronger in his determination. Right? अगर मैंने commit कर दिया, अगर मैंने बोल दिया, तो क्या होता है? It becomes very difficult to go back on the words. Now he's committed. He has to be right, and he has declared that he is ready to. So these are the various steps, WMACD of tobacco cessation, and this is what we say: develop a quit plan. That is the start. START. Set a quit date, ideally within 2 weeks. tell family, friends, co-workers without quitting and ask for support. Anticipate challenges to the upcoming quit attempt, withdrawals, cravings, and triggers, and prepare for dealing or coping with this. Remove triggers such as tobacco products, ashtrays, and souvenirs from the environment and make home smoke-free. Track progress and talk to your doctor to help you in quitting. So this is START. START. Set, tell, anticipate, remove, and track. ठीक है? We need to have commitment, and commitment का मतलब अगर announce कर देता है, the commitment is there. So commitment on both the parts, the doctor as well as the patient, right? Both need to be committed. Most of the time the doctors are not committed, then also the patient will not be able to, because we need to have an active follow-up. That is what I said. एक होता है passive follow-up, when we are not actually actively talking to the patient. We wait for the patient to come back. This tobacco, those who are quitting tobacco, their willpower will diminish very soon. The motivation may go away and they may not come back to you again, right? So a regular follow-up with the patient is very important. So there has to be a commitment. Okay? What is the best modality of commitment that you know that this person is committed? Yeah, Urvashi हंस रही है, बोलेगी नहीं.
The best method is when we offer and the person does not take, but then here we cannot offer only.
What you will offer? You will offer. Okay. Okay, that is good. ठीक है. अभी तो स्टार्ट ही कर रहे हैं ना, वो तो बाद में 3 महीने के बाद में उसको देंगे, ऑफर करेंगे, then we will see whether he is committed, then he will not take. अभी तो वो बेचारा फंस जाएगा ना. Yeah, Nikita, Visuja.
Through regular communication.
Regular communication. No. How do we know that now this person has come to you and this person is staying in your clinic? Now, अब हमारे को भी तो जरूरत है कि this person is committed or not. हमें कैसे पता चलेगा कि ये this person is going to be a successful quitter or he will not be a successful quitter?
Declaration.
Declaration. Sudeep says declaration. Yeah, Sudeep says declaration. Right. That's very.
Yes. He himself will ask a question: what will happen to me? And if I'll do that, he will be more enthusiastic to quit than he will ask forward questions. कि ऐसा अब क्या होगा? अब मेरे को ऐसा क्या होगा? Like that.
Actively
क्या होगा? अब मेरे को जो भी होगा मैं तैयार हूँ उसको संभालने के लिए. आप डॉक्टर, I am आपके साथ, आपको
मैं सरेंडर कर दिया है ऐसा. आप जो बोलोगे.
सरेंडर. Wonderful. और क्या?
And so whatever the doctor is advising or prescribing, he's following up and he's taking it seriously, coming to for a regular follow-ups, staying connected with the patient, with the doctor.
That is another thing. Wonderful. Immediately और क्या हो सकता है? तुम लोग फ्री करोगे कि पैसे लोगे? Suja, you will do it free or you will take some money for this? फ्री करेगी. वो तो बोल रही कि हाथ जोड़ करके मैं माफी मांग लूंगी, फ्री कर दूंगी. क्या करेगी? या धारा, सूरत में तो सबसे ज्यादा पैसे वाले लोग हैं सूरत में. फ्री करेगी कि पैसे लेगी?
If patient is capable, then I will take charge, and literally patient is poor and he is willing to quit, then I can
Wonderful.
make
So
it free also.
I can work professionally. I will take a charge or I will do it free of cost. See, the most important way of ensuring that he is committed, when he pays your fees and says that yes, I'm going to pay you your fees for 3 months of consultation, right? So if he is ready to take the package, that means he's ready, he's committed. That is the sure sign of commitment. And the second very important is the declaration. That is when he says it, puts it in the Facebook, puts it everywhere that I am committed and I'm going to quit. So the most important, probably immediate knowing that he is committed is by when he pays for your entire 3 months
Advanced consultation.
Advanced consultation. That means that is why we made packages, 1 month package, 2 month package, and 3 month package. If he's ready to take the package, you know that this person is committed. If he says that अच्छा मैं एक बार दे रहा हूँ, next time देखूंगा, he is not committed. He is going likely to fail. ठीक है ना? So this very important. See, we doctors also want to make sure that the other person is as much committed as we are committed. ठीक है ना? So this is one of the ways of knowing. जो फ्री के पेशेंट्स है, वो तो आएंगे और जाएंगे, उनसे हम लोग बहुत ज्यादा कुछ कर नहीं सकते, ठीक है ना? We can never ensure that कि they will be committed. ठीक है? So this is I think clarity आ गया.
फेसबुक पे डालेगा पेशेंट तो फिर हो गया, खत्म, फिर इज डन. यू कैन बी 100% श्योर कमिटेड.
यस, ठीक है. वाइफ को जाके बोल देगा, अपने बच्चे को बोल देगा, ठीक है ना? So if the patient comes with his child or daughter to your clinic, that is also an assurance, that is also a commitment, क्योंकि बच्चों के सामने कोई नीचा नहीं दिखना चाहता, ठीक है?